Good afternoon, everyone. Very welcome to everybody in the online education provided by KIMS Cuddles in the session 30 about developmentally supportive care. I'm Juhita and I am Masters of Physiotherapy. I have done my certified neonatal therapist as well, and I am also a certified lactation counselor. So let's begin with the topic. Today, whatever I'm going to say is more of therapeutic interventions, and let's begin to explore more about it. Next. So today's learning objectives are, we will first understand about the importance of neuroprotection in the NICU, why it is important. And then we will move forward understanding and recognizing the challenges. Like we all know about the motor development and the sensory development are different in the womb versus in the NICU. So we will understand what kind of challenges the baby faces during the development in the NICU. Then we will move forward and see the component of developmental supportive care. Next, we will also see that different strategies which can be used in the NICU to promote the neuroprotection. So what is neuroprotection and why it is important? So neurologic and the sensory systems are interdependent and they contribute to have the neurobehavior in ourselves. So whatever the sensory system is getting the inputs from the environment, we will behave in that manner. And it will also help in the neurosensory development. So what kind of environment you got, negative, positive, accordingly you will behave in your further life. So that's why it is very important. And every sensory integration or every sensory motor response is depend on the feedback loop. For example, if I'm touching any object, I will interact with that object, and then I will see, okay, this is safe for me or not safe for me, or what I am going to do about it. Or for example, if you will see right now what I'm saying also, you are interacting with me, you are listening that, and then you are understanding it, and then you are giving the response. So likewise, there is a always a feedback loop happening. So there are n number of feedback loop happening in the NICU for a baby. So then it is like from internally also happening and externally also happening. Externally are the environment, which is like all macro environment, which we will see in the further slide. And internally, there will be some kind of changes happening, like some growth hormones are there, which is interacting with the baby, or any kind of development which is happening. So we will, to have the better understanding, we will divide them both, and then we will see how we can protect those things. So it's very important to protect the neuronal death. That's the main concept behind the neuroprotection. So it is like a strategies to prevent the neuronal cell death. It also prevent to decrease the cell death, and it is allowed to heal through developing a new connections in the pathway. So every time the new connections which is happening, we should be make sure that it should be positive. Next, we will see the what are the cradles and the motor challenges the baby faces in the NICU. So if you can see the position which the baby have in the womb is all in a curved shape. They will be like having full hands near the face. The midline, body midline will be there, and then the legs towards the body, it will be there. If when they born early, definitely we know that the baby is not having the boundaries. So what you will see the changes, like baby will be having the extended hand or the extended neck, so which we or the head is falling in the sides because they don't have good muscular control near the face and the neck and the full body. So there will be changes, there can be a changes in the shape of the skull. So this is the one big concern about the from the parents, which we see in our follow-up clinic. They'll be asking, can we do anything about this? This shape has changed. So we should be very mindful when we are seeing all those things happening in the NICU. If it is always in the one side, we should change the position and all. So this is the first changes. If we'll go from the top to bottom, this is the first challenges which they face. So then next, you will see that there could be a tightness in the one side of the neck muscles, which we call a torticollis. It doesn't happen every time, but we should be very mindful, because if the head position is already remain in a way same side, then it's a risk factor. Next, there should be a shoulder girdle. If you will see the shoulder girdle, if they'll keep the hands away from the midline, it becomes very difficult to self-regulate themselves. So this is also one big challenge when it is very important in the neonatal period. Next, we will go to the trunk. So we want a C-shaped trunk, but in the contrary, what you will see is the baby is falling like this, and it's making the opposite curvature. So which will again very important, because when the sitting will come, at that time child will always fall back like this. They will not able to maintain proper sitting position, and it will be difficult for them to bring hands on the ground to balance themselves. Next, if you will see the hip position, it will be again, if you will see here, the child is lying on the bed, and hip is like a M kind of position. So, and externally rotated. So when the child will come on the stage of crawling, so it will be very difficult for them to bring both the legs together and crawl properly on all fours. So they may develop to some other alternative crawling positions, or other alternative locomotion position, like they'll do bottom shuffling, or they'll crawl like a bear, or they will do bunny hopping kind of things we can see. So these all things may come from the NICU environment, and it could be also lack of stimulation to the babies. Okay, next, if you'll see foot and ankle, it will be always falling like this. It's not kept easy, straight. Then again, they will be having issue while the walking, or they may also do the toe walking sometimes. So these are some motor challenges which they face in during the NICU period. See, here I have kept some example of shape of the head. You can see plagiocephaly, bradycephaly, and scapocephaly. I want to emphasize that bradycephaly, it's very important that we should avoid such shape, because there the vision area is there, and if it is got affected, the baby could have some or the other visual perception issues, like depth perception may get affected. If they are seeing something, it's not stable for them. Sometimes it can also happen, and then it becomes very difficult for them to walk alone. And of course, that will further have issues with their reading, writing development. So let's move on to the sensory system challenges. So as we all know, there are different sensory systems. Like first, which develop is the tactile system. So make sure that whenever we are touching the baby, it should not be in a negative manner, because as the research already says that a baby went through around 10 to 14 procedure per day if the baby is sick. So that's why the other tactile stimulation which we are giving to the baby, it should be very, very mindfully we can do. Okay. So next is vestibular and proprioception. So what is vestibular is like the sense of balance. Whatever we are moving in the surrounding, we know that we are having good balance, and that's why we are confident enough and we are moving. So that how it is affected in the neonatal period, whenever they are lying down on the bed, it's always lying in one position, then the development doesn't happen in a proper manner. Or if we are suddenly changing the position of the baby, like if you want to turn on the sideways, or you want to turn prone, or you want to give the baby, transfer to the baby during the KMC. So if you will do sudden movement, that will again cause the issue in the vestibular system. Proprioception is nothing but your body sense position. So what I'm sitting right now, I'm sitting erect. I know that if I'll close my eyes, then also I know that. So your body position with regarding to internally and externally, you know that because we have intact proprioception system. So that is also very important in newborn period. They are not that much aware. It's still developing, and then if we will not provide a correct position and all, the baby will have poor proprioception. Okay. Then next will be the visual system. So visual is a last system to develop. So whatever the visual stimulation happens, it should always happen post 40 weeks. We should not stimulate the vision much before that. And it's very important that the light should be controlled in such a manner that the baby should not have any visual kind of issues. So, or overstimulation should not be there. So they may have like they'll do like this if there is any photophobia or something like that. So, or as soon as they'll enter the room, they'll just cover their eyes like this. So these all are signs that we see when the baby come for the follow-up. So that's why we will more see about the intervention and strategies, what to do for this. Then next is the auditory and olfactory. So we know like about the sound. It's most of the time if there is a sound, if the baby is sick and if there is any emergency happening in the NICU, the sound will go about like 100 decibel or something like that, where it's recommended the sound should be like 45 decibel. 60 is still not acceptable, but still it happens, it's okay. But it goes more than that. So we should be mindful while we are asking for some help or something. We should say in such a manner that the baby, other than the sick baby, should not get affected. So next is the olfactory. Whenever we will think about olfactory, it's not only the regarding the food, it also regarding the disinfectant or the sanitizer which we use in the NICU. So we do sanitize our hand before touching the babies. But what we do, suddenly we'll go and touch the baby, that will give the sudden olfaction stimulation. And those uh, pungent smell can reduce the oxygenation in the brain. So that's very important that whenever we are using the sanitizer or something like that, we have to wait for a minute or not at least 20 seconds. And if you are drying also your hand, it should not be near the isolate of the baby. It should be away from the baby's cradle or something like that. Okay. So these are some kind of behavior changes which we need to adapt if we are seeing the baby in the NICU. So because this is the biggest challenge for them to overcome. They cannot express themselves, and on that time, if we will give proper support, the development will be good. So next we will see the components of the developmental support. supportive care. So I have divided it in a macro and micro environment for the better understanding. Okay, so there are macro environment means, so we will take as a which is not in a direct contact of the baby, which is little like far from the baby, and micro, which is directly you are intervening to the baby. Okay, so let's say partner, these are the already made component which I have adapted, and you will find this in a few papers as well. It's very good to follow this component. First is like partnering with the family. Okay, when should we start our counseling? If anybody wants to answer in a live chat, you can please answer also. What do you think when you will start your counseling with the parents if the pregnancy is high risk pregnancy? At what time or at what period? Okay. Then next is positioning and handling. Then next is a safeguard of the sleep, which is very important for the brain development. We have to also minimize the stress and the pain. Protection of the skin is other. Then next is the optimizing the nutrition. So if you will see the this component here, you can see the things are overlapping. So healing environment is the environment which is the micro environment, which is directly touching to the baby. And positioning and handling and safeguarding the sleep, there is some overlap happening for the light and sound. So if you want that to focus on that two component, you have to make sure that the lights and the sound is very well maintained. Then next is here in the same manner you can see minimizing the pain and stress and the skin protection. So smell and the taste is the one thing which you have to be very mindful for those two components. And for nutrition and nutrition, the touch is very important. Why? Because the NNS and the way you are touching to the mouth and all, this is something which we have to make sure that it's going in a neuroprotective manner. Okay. So here you can see a baby is sleeping very nicely because the baby is well contented. Light and sound is maintained well. So baby is showing little bit smile face also, though the things are going on a lot with him. So this kind of position or this kind of containment and care, if you will give the the development of the baby will be very good. So what all things you should see in the, what all things you should do during the antenatal period? At the end of the second trimester, if you know the baby, the pregnancy is high risk pregnancy, you can at least talk once with the baby. If the baby comes early, what? How you should counsel it's very important that you do not tell or do not say everything, but at least some gist of the consequences, if you will tell, the parents are well prepared for that. And when they'll come to NICU, they are strong enough to take on all whatever is going on with the baby. So at the same time, you also have to tell about the feeding, because as soon as the baby is out, the first thing we want is the mother own milk. And at that time, if anybody is going and counseling the mother, it's not necessary that mother will take it in a positive manner. So we have to make sure that we should do antenatal counseling for lactation as well. It's very, very important. Then actually the lactation counseling can have we can do before as well, but it's crucial time, at least at that time we should do the lactation counseling. Next is we must explain about the sequelae of the prematurity and any associated issues. So during the discharge, we must tell that what it could happen, depend upon the how is the baby condition and all. Then next is the timely follow-up and its benefit. Why it is important that whatever we have missed to say or to check, this can during the discharge period, that we can do whenever they are coming for the follow-up. And it's best time because at that time parents are also a little bit calm to listen everything whatever we are saying. And they can do much better the they can do much better at that time. Mother is also a little bit relaxed and all. So, timely follow-up of the baby, we should always do during the discharge, then 3 month corrected, 6 months, 9 month, and 12 month corrected. And if the baby is any high risk baby, so then we can do like at a 4.5 month also, or during like 6 months and then 9 month also we can do. So, or in between 8 month also we can do. So depending upon the baby's condition, we should ask for the follow-up if the baby is high risk. Otherwise, if the baby is growing well, 3, 6, 9, 12, and 24 is the good number. Then next is the encourage the home program and its importance. See, most of the time the baby is staying with the parents and in the home. So whatever the stimulation we give to the as a home program, that is very important. Okay. Then during the NICU period, the parents should be allowed 24 hours in the NICU, as I think it's happening everywhere worldwide now. And also some relatives, if parents are not available, then they can also go for the KMC. So here I have kept one educational and evaluation tool called iPad. And this is like for positioning, maintaining position, good positioning in the NICU. It's like you can see head, neck, shoulder, hands, hip and pelvis, knee and ankle and feet. So here this extreme end, your left side is the which is bad position or inappropriate position, you can see. The opposite side is the good. It will be, it's given marking like 0, 1, and 2. So the total marking for this is a 12. And the if the score is less than 8, then the baby may need some kind of position correction. If it is 6 or 4, definitely you have to again redo the positioning. Okay. So here there are some example of appropriate positioning versus poor positioning. So these are some pictures when I was working in very like very initial stage, and I was not much aware about the developmental supportive care, and we were thinking that this is the best we are doing. So this is how we learn. So that's the reason I have still kept such pictures just to see the progression, see how it has changed over a period of time. Here you can see the first baby's picture. The hands are not in a correct position, not in the midline. The legs are also not well supported. This baby nest is a small nest. It's like the legs are not having the support or the boundaries. So it's very important that they have some recoiling movement happening with the help of boundaries. Why? Because that will help in the muscle development. It feels as if they are still in the womb, and where they are kicking and moving, and that is a helping for the development. Next is the here you can see some appropriate positioning. The head of the baby is on the side, but you can see eyes are well covered. Very little light is also going, which is important for visual development as well. Then hands are near the chest. If it is not near the face, near chest is also good. Legs are well supported. Ankle and feet is also well supported. The curvature of back is maintained. And next you can see the picture of a swaddling. So I will show all this thing how to do practically at the end of my session. Now we will move forward. So some recommendation from my side. It's not like you should do that only, but from my end, it is like if the baby is hypertonic baby, if you know that baby is gonna have some tone abnormality, you can give a sideline more than the supine or prone. Why? Because in prone position, the due to the gravity, the flexion is more acting on the baby. In a supine position, the extensions is acting more on the baby. So we want something which will help the baby to bring the hands and the legs in the midline. Sideline is the best position, and also it is like a gravity eliminated position. Okay, so that will help a lot. Next is a hypotonic baby, because we need lots of visuals. We want to check the baby every time if they are having any issues. So it's best to have them in a supine line position. If the baby is having any extension thrust or any GR is there, you can put the baby on the prone position. That is more helpful. In the GER, after like feeding, mostly after 10-15 minutes, you can put on the prone position. And the tummy of the baby should not be uh, so tummy of the baby should not be pressed. The whatever the support you are giving for the prone position, it should be till the sternum only. Okay, that will support to reduce the GER. So some handling recommendation from my end is the steps during the KMC. So how we will start means we have to first counsel the parents. So it's not like please come for the KMC. If you will just give this one line, they will come, but their dress and all, it's if it is not appropriate, then we will be ending up transferring in a wrong manner. So we have to tell them that whenever you are coming for the KMC, please wear such and such a dress, and this is the way we are going to keep the baby on your chest. You have to remove your dress, and then directly the skin contact will happen. Before that, you have to first go for the washroom and eat and everything. At least minimum 1 hour the KMC should go. Maximum you can give as much as possible. We can also give them counseling, like it is very important for their brain development and the skin development, whatever the heart sound they are listening. If your mother is there, you can say that whatever the heart sound they were listening while they are in tummy, same heart sound and breathing sound and the breathing pattern of up and down movement they will feel when they are in the KMC. So these few points from that, if you will say, that will be like encouraging to the parents to come for the KMC, as well as it is like you have prepared the base ground for the proper handling and transferring as well. Okay, so here I'll show you the two methods of how we can transfer the baby during the KMC. So in first, the mother is only taking the baby on the chest directly, and in the second, I am giving the baby to the mother, and I'm in the same time I'm taking help of mother as well. I have already spoke with mother what she's going to do and how she's gonna help me. I've already checked that the all the tubings and all the connections are well secured, so that while the transferring, it's not a issue. Let's see. So in that, the mother is leaning forward and then lifting the baby and going and sitting in on the chair. It may happen that sometime if the mother is feeling dizzy or something, so while the mother is coming for the KMC, we have to first ask about that, how is her health? If she is well, uh, that she can stand for a longer time or understand what you are saying, or if she is feeling very dizzy or something, then do not go for this kind of transferring. Okay, so here you can see how I'm taking the help of mother, and we are transferring the baby without any jerky movement. Next comes the handling. It's very important how we are touching the baby as well during the handling. So one main thing is diaper changing. So first we will just see the video. So why it is important to turn the baby into the sides rather than just lifting the legs? Because we know that sudden change in the movement can shoot up the BP, and it may end up in any kind of brain damage or something. Um, I think you people are more much aware about this, but here I have shown how to turn the baby and do. One more method can be there when you know that you cannot turn the baby because of some other reason, like any ventilator tubings are there or something. So at that time, we are supposed to. So at that time, for example, this is the shape, this is the way the baby is lying down. Rather than lifting the leg and the buttock part totally up like this, you can just bend the legs and then sides. It should not put the pressure on the tummy area. So this is the way they can we can teach this to the nurses, and they can do the diaper change the other way. Okay, the first one thing is like always rolling the baby and do, and the other thing is sideways, no pressure on the tummy area. Okay. All right. The next is like one thing like previously, we used to think that if we will turn the baby suddenly, they will not able to appreciate those movement, and they will be okay. But it's called like baby flip. So one thing is that nowadays we should not practice like that. Whenever we want to turn the baby, change the position, do the log rolling. That is better. Like slowly you have to turn, take the hands and then legs, and then from supine to the sideline, we should turn the baby. Okay. Um, Positive touching or hand hugging is nothing but just like you are putting both the hands over the feet, or on the belly, of the one hand on the belly and one hand on the head, which will help the baby to have some positive touch, and they'll feel better about it. So this can be one thing which we can teach the parents, because they of course they want to touch the baby. We should not say whenever they are coming to the NICU, don't touch, because this is what happened most of the time. Things are going, and then we want like the baby should not catch any kind of sepsis. Anyhow, they have washed their hand. We should ask them, don't touch here and there, but you can touch the baby. So this is the one thing which we can adapt, and that will also make them feel happy that we got a chance to touch the baby. Only visual rather than that, when you'll touch anything, you get good feedback. So those things we can adapt for the parents' happiness as well. Next is the protection of the skin. So it's very important how you are removing the adhesive tape. First of all, the adhesive tapes which we use, it should always be silicone based or an alcohol free adhesive tape. Then next, as we know, like the humidification is important. We know that the mother chest is the best part for the baby. So we can always put the baby on the mother chest for because it gives more than 50% of humidification. We can use the tegaderm kind of thing, which is better, or the silicone tape, which will be not having much abrasion on the skin. We should always check the any skin breakage, because skin is the one thing where it's a large sensory system, and then it can catch infection easily. So that's the reason it's important. Whenever you are removing the adhesive tape, first we have to soak the tape very well, and then only slowly we have to remove. It should not be like sudden removal of the tape. And if you are removing a tape from any area, here if the tape is there, we are slowly at the corner of the tape, first we will start, then slowly we will take it out, and we will put the pressure on the skin as well, so that it will come out easily. It should not be like we are just pulling the tape out away. Okay. Then next, safeguard sleep. Sleep is very important part for their brain development. Okay, and it is directly related to the uh, increased number of brain mass. Then what we can do for that is a cluster care. We know that we have already planned some kind of investigations or something, so that we can do first, and then we can position the baby very well. If anything is planned, we should not again and again go and disturb the baby. Cluster care can also happen before the feeding as well, because we know that before the feeding maybe they will wake up, or they are not in deep sleep. So at that time we can little bit talk to the baby first, and then slowly we can go for such cares. We should not abruptly suddenly go and touch and start any kind of procedure. So that is also very important. Next is the nesting and swaddling that we will see, and modifying the environment like cyclic light, which can be start from the 32 weeks. And we should always promote the quiet time in the NICU. It's not like only the 12 hours which spend it in the night, but other than that also we should have 1 hour or 2 hour of quiet time in the NICU, which is dedicated, like no, we will maintain less than 45 decibel the sound in the NICU. So that will also support the sleep of the baby. Next comes the minimizing pain and stress. So I am going to talk only about the non-pharmacological pain management. Skin to skin is one and the most foremost thing. It goes for anything, any kind of intervention. It's important to always promote kangaroo mother care. Next is the breastfeeding. So how we can help, like if they can do breastfeeding, and if we want to do any kind of procedure, we can ask them that post breastfeeding we can do the procedure. Okay. Or if the procedure is already planned, we can give the baby to the mother lap, and immediately they can go for the breastfeeding. Non-nutritive sucking also we can give either with the empty breast during the position or procedures, or the sisters can also give the gloved finger for the NNS. In that, sister can also have the expressed breast milk, and baby can have that as a non-nutritive sucking. Then we have to facilitate the swaddling. So when we are doing swaddling during the procedure, we should always like take out only that part where we want to do some procedure. For example, if you want to put the lines, the other part of the body is covered, swaddled well, and that only the hands or the feet are the out of the swaddle. Then next is the sensory intervention like maternal voice. Okay, if somebody is giving some kind of it's okay, then you will also feel like okay, theek hai, no problem, there is no issue. So slowly we will also able to regularize ourselves. The mother voice is very important at that time. And if the mothers are not available, then we can give the scent of the mother, and then also any kind of massages can be done by the mother. Then next is the sucrose solution. It's very easy for us to bring the sucrose and give in the mouth and for the baby who is very distressed. But we have to be very mindful while we are using the sucrose. If a baby is going through 14 to 15 procedure in a day on an average, every time if we are giving sucrose, it's not good. Rather than that, we can have expressed breast milk, which can be given during the procedure or after the procedure. We can also use the local application of lidocaine jelly 2 minutes before the painful procedure, and then we can go for the any procedure. 2-person care and 4-person care is recommended if there is any procedure, rather than just 1 person handling and doing something and the baby is crying. So rather than that, soothing if somebody is doing, that will be more helpful. So next come the optimizing nutrition. Colostrum swab, we know very well that it's very important. Non-nutritive sucking also, it's very important during the tube feeding. Next is mother's scent, which can be given so that the nutrition is stimulated whenever the baby will go for the direct breastfeeding. It's very known that scent is known for the baby, and then they will accept it easily. Next, we can also promote mother holding the baby during the feeding. If only during the tube feeding, if mother is also present, that will be also helpful. We should avoid the use of any kind of adverse like, as I always said like disinfectant and all. So we should avoid giving suddenly near to the face. We can also give the milk drop to the baby after the painful procedure, or other than that as well. If you will put 1 drop with the 1 ml syringe on in the baby's mouth in some interval, like let's say before the feeding or something, that will give the taste to the baby. That will also encourage mother to express the milk. We can also tell her that we are giving one drop. We are not giving the milk by mouth, but at least one drop is going for the taste and all. So that will be encouraging for mother as well. Okay, so next is the oromotor stimulation. It's said that we can start as early as 28 week, but my recommendation is if we are doing colostrum swab, if we are doing milk drop method, then for oromotor stimulation, it's okay if we will go during the transition phase. And for those babies who are having any issue for the oral feeding, every baby does not every time need oromotor stimulation, and it's not necessary that we should always stimulate, or it's like adverse for them. It's like a not good experience if we are touching every time their mouth. It's very sensitive at that time. So rather than that, whenever there is a transition phase, you can go for the oromotor stimulation if the baby is having any issue. Here I will show you some perioral and some intraoral stimulation. We will see one video as well. First, let's see the perioral. So if you will see here, okay. So from here to here, first stimulation you have to do. You can do 5 repetition each. Next, near the nose till the angle of the mouth, you can go in a C shape. Next, on the upper lip, you can go. Next, you can press the chin, follow the jawline, and reach to the TM joint. For swallowing, you can just press the chin and then just go from top to the bottom like this on the neck. That will support the swallowing. These are some basic steps which I'm showing you right now. Okay, so this is the for perioral stimulation. Next, if you will see the intraoral stimulation, we're gonna stimulate the tongue, cheek, and the hard palate, gums, and the bite, basic bite. We're gonna stimulate. So during the oral stimulation, we can have the express breast milk. So you can see how I'm in between taking the and removing my hand out so that whatever the saliva is secreted, it will enter. You can also give their own hand for sucking. So first, whenever you are giving the water stimulation, keep the mother own milk ready. Also, you can give for the first only touching on their hand so that they'll be aware that something is going to come. And then you can give for the smelling. And then slowly you can start the stimulation. So first step, what I have done is from here to here, TM joint to the angle of the mouth, inside, in and out. Then next I have done is the for gums, on the gums. Next, we can also do between the two gums. If you will keep some pressure, the baby will bite on your hand. So you can stimulate that biting. The next we can do for the tongue. So here you can see the tongue from side to middle we can do. We can also do the in the mid on the mid blade like this. Pressure up and down. Okay. And next you can give for the non-natal sucking. If you will give some stimulation here, anterior 1/3. We should not go so much in. Only anterior 1/3. It's enough. And the baby will do sucking on your finger. So these stimulation should not take longer time, and it should always be how much the baby is able to tolerate. It's not like we will keep on going. If baby is still not it's avoiding and crying, then we should stop there. Okay. So next I will also show you some techniques to do the positioning. So you have to take the square bed sheet. Specifically. You can fold it from the one end, one corner actually. Always make sure that whenever you are doing positioning, check the distance between hip and knee. Whatever the distance is there, that much you have to fold the height of the nest. So rolling is not recommended. If you will roll, then it's become easy for the legs to go out. Okay. So we're gonna fold it according to the height of the baby. Then next, we have made nice nest. It will give the feeling as if the baby is still on the womb. This, and then like this you can do, make a nest and one more bedsheet which will support the shoulder. So it's important that the leg portion should have good height. And you can keep the babies like this and fold. Okay. So this is the position for the nesting. We can make this nest and keep it ready whenever a baby comes. We can directly put it. For the supine, then for the sideline, you have to keep one more support here so that baby is not falling back. Okay, or it's not like baby is hanging. Okay, for the prone position, we have to keep it vertically straight like this. Baby can rest here. So we are not putting much pressure on the tummy as well. The legs and the hands are having good room to bend and bring near the face. And here you can see some bend as well. And then they can rest. So this is the technique for putting the baby on the prone position. Okay. We forget sometime, we'll keep like this and put the prone position. You can see the difference. The hand is going far away, which is not recommended. We want the hands to be near the face. Okay. So this is some positioning method which we can follow. So these are few techniques which can be for for and to say that some yeah, sorry for the technical glitch, everyone. If anybody has any question, they can ask, or we can end this meeting. It's nothing. Then we can end it. Thank you everyone for joining us. Have a good day. Bye.